Nitroprusside and isoproterenol used as the major prerequisites. Introduction. In the web of steroid prices is granted the number of patients receive the hard drugs, Nitroprusside allows prosterenol and find dramatic bid and repeated video.
Okay, it's time to talk about Nitroprusside. So the clinical case here, a 28-year-old African American presents to the emergency room complaining of severe pounding headaches. As you question him further about his symptoms, he also tells you that his vision has become blurry over the past few hours. Physical examination reveals a well-nourished man who appears disoriented.
Why does this happen? These causes are often linked to red snake drones of snake discoveries. What is really unusual is that deaths through heart failure or due being of the market for decades, so the price increases of the type of drones are something we only see in the 5 years video.
Sodium nitroprusside, also known as SMP, Nitpride, or Nitropress, is an inorganic, antihypertensive, and fast-acting, non-selective vasodilator. Nitropress is available as 50 mg flip-top vial. Each 2 ml vial contains the equivalent of 50 mg sodium nitroprusside dehydrate in sterile water. Depending on the desired concentration, the solution containing 50 mg of Nitropress must be further diluted.
Pros and cons. Pros. Pharmaceutical will have more money. People will not butane is this not really necessary. Cons. It's both affect the hospital administration of the drugs to patients. Less people will be able to acquire these drugs. Video.
Isoproterenol is an important topic. It is 3 out of 5. That means you should probably know a little bit about it for your tests, your boards, your exams, things like that. Its brand or trade name is Isopro. It is a synthetic, non-selective beta-adrenergic agonist. Now, synthetic means that it is not produced naturally in the body. We do produce this medicine in a lab through
Use after. What happened with the use? Foreign major price increases. Use of the two current medicine as dramatic. Description acts 14-7 hospital according to the recent latest period. Is the New England Journal of Medicine. The number of patients in the hospital having Nitroprusside decreases from 2012 to 2015. Video.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from
First Aid for the USMLE Step 1, 2013 edition. Page 236. Norepinephrine and isoproterenol. Please refer to the picture of norepinephrine versus isoproterenol in your books. Describe the effects on blood pressure and heart rate when norepinephrine is administered. In the picture here, you see when norepinephrine is administered, there
Conclusion. Pharmaceutical industry show medical more less issue of estrogen the spread of like 7 on verification action of it. because they are not really seeing the effect the drug-like price is having in so many people and hospitals. Well, they cannot afford many drugs anymore, and what is that causing in their haters video.
Hi, we're Group 2, and today we will be introducing the effects of isoproterenol, caffeine, and high concentrations of potassium on the frog heart. Before going into the results of our experiments, let's first review some general concepts required to understand our data.
One of the recordings taken during our experiments was the ECG. The ECG is a recording of the electrical activity and volts of the heart over a period of time. In the human heart, there are three major events in the ECG: the P wave, the QRS complex, or sometimes RS complex,